Hello there, this is Oran Kivity, and today I'm going to show you a simple way to treat sore throat by using Ontake warm bamboo. So first of all, I need to show you a 30-second clip, which is Ontake in a nutshell. What the hell is Ontake? Fill a piece of bamboo with Moxa wool. Pack it firmly. Compress it, light it, and tap the warm end lightly, rhythmically on the skin. So now that you understand what Ontake is, let's revisit yin and yang and see how we can use it in terms of general acupuncture principles. The first thing to remember is that yin and yang can also be used in terms of anatomy, so heaven and earth at the feet. So there's a vertical line that goes from the top of the head down to the bottom, and this gives us our sagittal, frontal and transverse plane. There's a line going from top to bottom that divides the body into left and right halves. There's a line going from top to bottom that divides the body into front and back halves. And finally, there's a line that goes across at the level of the navel that divides the body into upper and lower halves. So this produces what Dr. Manaka called his octahedral model. In other words, 4 anterior quadrants and 4 posterior quadrants. And for treatment principles, we want to use this idea of opposites, yin and yang. So upper quadrants treat lower quadrants, and front quadrants treat back quadrants, and left quadrants treat right quadrants, and vice versa. How do we make that relevant in terms of sore throat? Well, if we consider sore throat, it's in the superior part of the body, and it's anterior. Usually it's on the midline, but sometimes it's on one side, slightly to the left or slightly to the right. Or maybe it's worse on the right side and worse on the left side. So to treat it, we need to find the opposite quadrants. So we want to look for somewhere inferior, posterior, and on the midline. And if the sore throat is on the left, then treat slightly on the right. If the sore throat is on the right, then treat slightly on the left. And that's what that looks like. So we're going to be looking at the sacral area because that's the direct octahedral opposite of the throat. Now we can also use channel pairings, and we know that in terms of channel pairings, we can use internal external as a pairing principle, or yin and yang. So let's consider which channels go through the throat. The most obvious one is the renmai, which goes along the midline and, as we all know, ends up here. And the kidney is another channel. So the kidney comes up through the abdomen into the chest, and at kidney 27 it sends a deep pathway that goes up into the root of the tongue. So the kidney channel is another important channel to consider when we're treating the throat. So if we look at those opposite pairs, then we have the bladder channel, which pairs with kidney, and of course the do channel, which pairs with the ren channel. Now we have the area, the sacrum, and we have the channels on which to treat. So let's get an idea of what that actually looks like. I'm going to show you a quick demo. The first thing you want to do is check the sacrum for reactions. And by reactions, I mean areas of hot and cold, or puffiness, or areas of pressure pain. So make a note of those reactions, and those are what we're going to try and treat. So we're just going to light our bamboo. And we want to make sure it's not too hot. So just tap against the palm of your hand and then against your wrist. If it's comfortable on your wrist, it should be comfortable on your patient. And we'll start by tapping lightly with the bamboo. And then you can get your patient to swallow and see whether there's been a change in the sensation of the sore throat. Then you can start to do rolling. Rolling is slightly deeper. So just rolling with the bamboo, working into the tissues of the sacrum. And once again, you can stop, you can get the patient to sit up and swallow again and see if there's been any change. You can also roll longitudinally along the line of the sacrum. Now, sometimes the sore throat will be more on one side than the other, and we want to treat the opposite side. So if the sore throat is on the left-hand side, you want to focus on the right-hand side of the sacrum. If the sore throat is on the right-hand side, you want to focus on the left-hand side of the sacrum. And if the sore throat is right in the middle, you focus more on the midline. So let's assume that someone has sore throat on the right. We would be rolling slightly more on the left here. And once again, check for reactions. If the pressure pain has changed, then you can finish. What can we expect to happen? Well, bear in mind that this is a branch treatment and should be integrated with your existing root treatments. So you do whatever you normally do, and then you can add 4 or 5 minutes of Ontake at the end of the session to relieve the symptom. Now, in my experience, a sore throat, which is a kind of 8 out of 10, will reduce to a 4 or a 2 within the 3 or 4 minutes of treatment. If it's a 5 or a 6, it should go away completely. But even if it doesn't go away completely instantaneously, you can expect within 30 minutes or an hour that people will be saying, oh, it's completely gone. This is a very effective treatment. And that's the beauty of Dr. Manaka's octahedral model, because we're using a region, a facet of the body, to treat another region. Now, you could needle the sacrum, but needles are very specific, and you'd have to put a lot on them to have a comparable effect. And you could do small cone Moxibustion, but again, you'd have to be very specific and really find those indurations and points to get an equivalent effect. Possibly you could use a Moxa box, because that also covers a broad area, but a Moxa box is missing one of the key components of Ontake, which is this rhythmic pressure and pressing, because you can really use your weight or press deeply with the Ontake to move those stagnant tissues. So I hope you've enjoyed this mini lesson. I'm planning to make a few more, so I'll see you in the next one.